hospitals together to share best practices and create benchmarks. So overall, the main aspect of KAHO has been to make the healthcare safer and more quality oriented. So today is the World Environment Day, and KAHO could not have been a way to celebrate this very important the day, which is celebrated every year on 5th June, to raise awareness about the environmental issues and promote global action to protect the planet. This day serves as an opportunity for individuals, communities, and governments worldwide to come together and take concrete steps towards a sustainable and healthy environment. World Environment Day serves as a reminder that our planet is a fragile and interconnected. It highlights the importance of preserving the environment for future generations. Now, World Environment Day holds, I think, special significance to healthcare due to the interconnection between the environment and healthcare. Healthcare itself has an environment footprint, including energy consumption, waste generation, resource utilization. And World Environment Day encourages healthcare institutions to adopt sustainable practices such as energy efficient infrastructure, waste management strategies, and eco-friendly procurement. These efforts reduce the environmental impact of healthcare facilities and contribute to a more sustainable healthcare system. I congratulate the Engineers Forum for organizing this very important program to sensitize the healthcare workers for the sustainable healthcare. And so we have a webinar today. What I'll just, of course, I will like to congratulate our chairman of the Healthcare Engineers Forum, Mr. Vinod Kumar, as well as the co-chair, Arul Kumar, and in today's program, especially the role played by Keerthi D'Souza and Dr. Karan. And I'll request now Keerthi to please introduce the panelists for the day today, and please proceed with the program. And I'm extremely sorry for the delay that has been caused by this technology problem. Thank you.
Sure, sir. Thank you so much. And even though it was a delay, but you have given us that energy that's required to start with this wonderful program. And as usual, you've always been supportive on the sustainability cause. And I've seen last 3-4 years, you've been behind several discussions around this. And today, in fact, this whole conceptualization of CAPS has been possible because of the leadership led by you, Dr. Lallu, and also Mr. Sam Mehta, Dr. Sam Mehta. Right, so wonderful evening to all of you and happy World Environment Day 2023. It is definitely a great moment for KAHO and all the interested stakeholders of KAHO to take this moment to celebrate World Environment Day with very eminent panelists gathered for celebrating this day for a cause and also being a part of CAPS launch. CAPS is basically KAHO's initiation of action plan on sustainability. And to celebrate this, we have gathered the experts from various fields who makes better sense to advise KAHO to give the input from their thought process, from their experience, how to move forward. And it is my immense pleasure and honor to actually introduce the moderator of the program, Mr. Vinod, who also chairs the Engineers Forum, and Mr. Arul, who is the co-chair for the Engineers Forum. The program will be moderated by both of them. Both of them come with serious commitments to climate action through environmental programs and also programs related to energy management. We just finished our conference of sustainability in KAHOCon. And also the meeting that concluded had a lot of reverberance of commitment related to sustainability is what we heard from Mr. Vinod. Thank you so much for taking this interest, Mr. Vinod, and leading this action on CAPS through the Engineers Forum. So I welcome you as a moderator and Mr. Arul I welcome you as the moderator.
Thank you, Keerthi.
Environment Day today, which has changed to sustainability. I mean, the definition expanded and the scope has expanded. And there's so much focus on sustainability, climate change, environment all over the place. The accompanying problem is about, you might have heard a term called greenwashing, where exaggerated or even false claims are made about, organizations claiming that they are following sustainable practices, etc. So the question would arise is, how do you prove that you are actually doing sustainable, you are following sustainable practices? And that's where third-party verification or certification, whatever you call it, third-party endorsement will come in, and that's the field I come from. Now, sustainability has a huge, scope. It could be the construction of a building, which I think Karthikeyan is here from IGPC. He would tell you all about green building certification. It could be post-construction maintenance of a building and the practices followed in that building. If it's a hospital, the practices related to hospital. If it's a hotel, the practices related to hotel. It could also be use of green materials or green products. Again, I think Karthikeyan runs a green pro certification scheme, but there are other schemes also internationally. There are plenty of schemes. I mean, there are plenty of schemes on textiles, for example. Hospitals use healthcare textiles. There could be sustainable textiles being used in healthcare. And then there's practices like, there are international standards like ISO 14001, everybody knows, on environment management, ISO 50001 on energy management, any of which could be adopted by hospitals and implemented in hospitals, depending on how much appetite, frankly, you have for certification, because sometimes I think there's a whole lot of certifications going on and, their audit fatigue will set in. And I'm also involved with I think it showed in my introduction, initiative by Andhra MedTech Zone Limited relating to medical devices, where we came up with the idea of having a standard for hospital laundries to promote multi-use healthcare textiles, including PPEs. I mean, that's another way of promoting sustainability. So there's a huge scope for sustainable practices, and then it will come to, credible evidence of following sustainable practices, which is where third-party certification or third-party verification would come in. And I think it's going to grow. So there will be more pressure. I can assure you, having come from third-party certification field, that there's a whole lot of problem there as well, whether third-party certification is itself credible or not. So I'm sure in course of time, you're going to see a lot of pressure, not only on you as organizations to demonstrate sustainability as hospitals, but also on the third-party bodies to show that they can credibly certify or verify sustainability practices of the organization. So I think with these limited comments, I'll stop here because it's a short time. Thank you very much for inviting me. And I would be very interested on what way your action plan goes and what kind of sustainability standards and practices you promote in the healthcare industry. And I would be happy to help you with my own limited knowledge that I have. Thank you very much.
Sure. Thank you so much, sir. Actually, I would just put in a word that I would take up the introduction of all the panelists and give it over to Mr. Vinod. And so he will continue with the questions so that the discussions can happen. So I'm just taking this opportunity quickly because we're short of time. I heartily welcome Dr. Karan, Dr. Sam, and also Mr. Karthikeyan, and Dr. Nitin, and also Mr. Sachin Joshi. And we couldn't make, Ms. Shobha couldn't make it, and Mr. Krishnakumar. So all of these people have been the panelists today, and they all come from great background, experience. And this is a great occasion where they are sharing the thoughts. So their backgrounds are so great. Each one of their background is so great and lengthy. Mr. Vinod, I would request you to please take over. And as you're asking the question, kindly hint on the background because I don't want to press on much time of yours. Please take over.
Thank you, Keerthi, and thank you, Anil sir. I request Arul Prakash to begin with the first question to Dr. Karan.
Thank you, Mr. Vinod. So my first question is to Dr. Karan. Dr. Karan, can you explain what is sustainability and what is its status in healthcare sector in India? And also, can you give us the overview of global role and UN initiative?
Thank you, Mr. Arul, and thank you to the KAO leadership for inviting me here today. Indeed, it's a momentous occasion as we launch CAPS, and we wish for this to become the premier program on sustainability for the health sector. To your question, sustainability, as we understand it, is basically the use of resources in a manner and form that it can be replaced, or at least enough is left for future use by subsequent generations or in the time period ahead. That in its essence is sustainability, which basically embarks on methods and methodologies to adopt around conservation of resources that we have available, ensuring that there is conscious consumption, ensuring that our own carbon footprint is reduced to a minimum. And within healthcare, we've seen that to be a challenge, because not only do we use a lot of resources, but the processing and the end product of those resources are sometimes toxic to the environment, and therefore the onus lies on the health sector to do a lot more. When we look at the global picture, the Western world, the Western health system has traditionally been much ahead of when we look at developing economies in terms of sustainability. But then again, their carbon footprint, their impact on the environment is much, much larger when you compare with the carbon footprint of the Indian health system or that of the developing world. So the onus again also lies on the Western world to do a lot more, just like on the issue of climate action. So when we look at the Western world, energy efficiencies, things like reuse of material, and the use of technologies to reduce the carbon footprint have all been in vogue, at least in the past decade. In the Indian context, we are very happy to see that we have a very conservative mindset when we look at usages. But over the past decade, that has changed. We have adopted Western healthcare systems, approaches and practices, and that has led to an expanding carbon footprint. And let's also keep in mind that the Indian healthcare sector is still growing. So as we grow, our carbon footprint is also going to increase. And therefore, it is very important to arrest our carbon footprint by adopting practices that are not only green, but lead to conscious growth of our carbon footprint as the health. So the onus is on us to not grow like Western healthcare systems, but to grow responsibly. And that's where CAPS really sits in. And I'm very happy that we are going to be announcing this program here today.
Thank you, Dr. Karan. Well said. I think looking at the current status of the growth in the healthcare industry and the increase in carbon footprint, obviously, KAHO's stepping into the shoes of sustainability is going to go a great way in controlling the carbon footprint. Thank you, Dr. Karan. And now I move on to Mr. Sameer Mehta, Chairman of Mehta Hospitals, Chennai. Sir, after taking up from Dr. Karan, looking at the expansion that's happening in the healthcare sector, what is that required for healthcare industry to turn around the matter of sustainability?
So I think first, we're late to the party, right? I think healthcare represents some 4 to 5% of total global carbon footprint emissions every year, which is significant. So we have to do our part. If we don't do our part, others will find also strong excuses to dodge the bullet. I think step one is India is a little bit of a more heterogeneous reality than most global platforms. So even though we say 4 to 5% globally, I think the sense of the Indian footprint is tertiary care and consumer-based direct footprint of carbon is probably higher for two reasons. One is a lot of our materials are imported, our parts, equipment are imported, one. Number two is, unlike most Western developed locations, your distance to travel to go to a healthcare system is much greater in India. People still travel from the Northeast to South India or West India. People still travel from rural systems to urban systems. And our percentage of urbanization is relatively low. So I think the scale of the problem is high. and probably higher in India than other parts of the world. Most of us know that a majority of this is upstream of us in the packaging industry, in the pharmaceutical industry, in the single-use industry, really not helped with certain patient safety norms like what we see with single-use devices and single-use safety apparatus. But let's come back to what we can do. So I think the first step is, I think the expert group here, and I reiterate what we talked about less than 3 months ago, which was, let's have a simple checklist of 10 to 20 things to do for different types of hospitals, whether it's a nursing home, whether it's a 100-bed hospital, 300-bed hospital, or a 500+ bed medical college. I think the set of tools you have are simple. I mean, there's simple stuff like LED transformation, maybe moving to heat pumps. From the water use, you could talk about mistifiers, which is also a resource saver. So there's a lot of simple things we can do ourselves. There's also things that are slightly more advanced in healthcare. For example, using medicinal plants in recovery areas. And we saw this in AIG in Hyderabad, where they have a 3% improvement in the local oxygenation content. And therefore, people during COVID benefited, but actually more than that, if you have that much greater photosynthetic production of oxygen in a hyperlocal setting, it is useful in a healthcare environment, right? So I think having simple checklists of things we can do makes life easier. But I think at the end of the day, we need more than awareness and the 54 participants. So for those of you who are on this call, go and talk to your fellow colleagues about why is the sustainability of whether it's environment, emissions, whether it's resources, is more critical, right? So first of all, if we are aware and we talk about it more regularly, it'll start getting measured. If we measure it, we start doing something about it. If we start doing something about it, we look for the most efficient and effective ways to do things. And that's where I think these simple checklists will help. I mean, nearly all the hospitals of folks sitting here, all the houses of folks sitting here probably are LED. But how many of you, for example, have water misters on your tap, which is a retrofit, right? How many of you have other simple systems like more efficient retrofits on your air condition? So the amount of air conditioned usage for the same outcome is higher. I think those are opportunities that we can implement. We can implement today, and we don't have to wait for us to write detailed reports. We should just get on with it. I think some great people around here. It'll be great for folks like Karan to, for example, share the best practice with Vinod, and Vinod to share a collective of those best practices with more of us. I think that's what's needed. The more best practices we talk to each other, the more we'll get stuff done. Thank you.
Thank you, Samir. Arul?
Thank you, Mr. Samir, for your insights. As you rightly said, we have to take small steps in this sustainability. And my next question is to Mr. Karthikeyan. Mr. Karthikeyan, so what is the initiative of CII and its contribution in achieving sustainability in healthcare?
Thank you, Mr. Arul, and a very good evening to you all, and Environment Day wishes. It's my pleasure to be part of this forum. And then a lot of things have been already spoken about the sustainability in healthcare industry. You know, from Indian Green Building Council point of view, as my Confederation of Indian Industry point of view, we have been working with the building sector in terms of implementing the sustainability measures. We have been working with a variety of buildings. And so far, more than about, say, 10 billion square feet of buildings we have worked with in terms of implementing the green measures. As part of this, the healthcare sector gains a significant share. In fact, if you look at from the carbon footprint point of view or energy intensity point of view, all of you might be knowing already, the hospitals are very resource intensive. So there is a need for obviously implementing the sustainability measures. So I would like to put it this way, when we are looking at the sustainability measure, whether it is a new hospital or the existing hospital, in both the cases, it can be applied. In fact, in my opinion, this has to start with the design. So when we are working on designing in the hospital, we can look at how the sustainability measures can be implemented. Even we can look at sustainable procurement of products and materials, which can contribute to enhancing the performance of the hospitals. Generally, our tendency is to look at the resource efficiency in terms of energy, water, waste management, etc. But when we are looking at green buildings, it is much more than that. It also looks at in terms of enhancing the health and well-being of the occupants. There are healthcare workers stay in the hospital for even 24 hours a day. So for them, it is important to take care of their health also. So the building environment should contribute to that. So when we are working on the green building concepts, we look at the resource efficiency. We also look at in terms of the health and well-being of both the patients as well as the healthcare workers, including the doctors. So the indoor environment quality, the way the systems have been designed to contribute to the health and well-being matters a lot. See, when I talk about indoor environment quality, we need to look at in terms of how the day lighting has been enhanced there, how the air quality has been maintained there, how the hospital-acquired infections are being reduced. All these aspects need to be looked at. So these concepts have been very widely adopted in India. We have been working with more than about 50 hospitals across the country in terms of, as of now, more than 50 hospitals in terms of implementing the green measures. So my sincere request to you all is, you are all engineers working in hospitals, as Mr. Samir Mehta mentioned, these all start with the simple measures, whether you are going to construct a new hospital or you are operating and maintaining an existing hospital. In both the cases, you can look at in terms of implementing the green measures. So I would like to stop here with these comments. Any questions, probably we can handle it later. Thank you.
Thank you, Mr. Karthikeyan. And well said, actually. I'm also an IGBCAP, proud to be of that part of that. And looking forward to CII and its contribution to healthcare in a very large way. Thank you, Mr. Karthikeyan. Now I move on to Dr. Usha Manjunath. Hello, madam. What are the social factors in sustainability? What is its importance and the current status that we have in our country?
Sure. Good evening, everyone. And I am very thankful to the organizers to have invited me on to this particular discussion. And of course, when it comes to social sustainability, there are lots of aspects of things. So it is not so much easy sometimes measuring and upgrading a lot of things, because human behavior, they say, is the most unpredictable one. So coming to the components of social sustainability, I'm sure we are all aware in terms of quality of life, equality, diversity, democracy, and social cohesion. So in healthcare, there are many people involved, providers to patients to various other aspects. Here, if we are looking at a lot of corporates, how does it convert into the social sustainability factors? So one of the things that is, of course, about human rights, fair labor practices. Whether health of the people, we already, somebody touched upon it, health, safety, well-being. These are very important aspects of it. As India is expanding, I mean, we are still not, investing a lot on public expenditure. So overall public expenditure is only about 6 to 8% in the recent years, and in the social sector, so to say. And we have lower expenditure across, when compared to BRICS countries also. So we really have to do a lot more. So how do we really look at, corporates really incorporating, the work-life balance, the living conditions of their own people, fair labor practices, especially, I think there is a little attention that from the healthcare perspective, because majority of the hospitals in the private sector are also like smaller ones. I'm sure there are certain, a lot of rules and regulations, but in the larger corporate and hospitals, and therefore we have to kind of translate that, support smaller hospitals, maybe KAHO could also be really constantly supporting, because there are lots of associations within the states also for these private nursing homes and others. And so therefore, if we look at these adaptive strategies, trust, diversity, as we all know now, trust is in the healthcare sector for social sustainable mechanisms to really function is rather low. I mean, trust between the providers, or like say, for example, trust from the patient perspective to the hospitals, patients with the government not trusting maybe the private. So the trust factor has to really work. We have to keep our own work the promises well. And another one very important for India, I mean for everyone of course, is the capacity for learning. So capacity for learning, as well as in terms of social structure aspects of the organization, and developing that common meaning. So one of the few things that people have been now telling is in terms of how do we really, the new words on social sustainability would be competence, influence. Influence is a very important one. We are training part of the institution, and I always say influence our students to develop sensitivities to the environment, to the other people, what the work they do. I think we all have, in different roles, small, big, in whichever way, I think this influence is the very important one. And then making sense, or the meaning part of it. I think that's very important, because there are too many things happening in the social sector, in the sense social dynamics, especially the technology advancements, after COVID, so many changes that have happened. So in terms of skills, education, all this have to be really kind of addressed, and we have to look at new innovative strategies. A couple of things that we all can look at. We already had talked about, whether it is the environmental sustainability, which has to be managed. Again, people are going to be involved. So socially, we have to look at, influencing people. One of the things that, we can probably look at is volunteering. Maybe the hospitals can also start looking at, like schools. We have seen involving the community, engaging the community becomes a very important one. So I think for social sustainable mechanisms to really function and kind of infiltrate and penetrate, I think we can look at some small interesting strategies like volunteerism, like say having a lot of community engagement. These are some of the things, we could probably be really looking at. Again, at the end of the day, all aspects of sustainability has to start with ourselves, individuals, maybe translate that into the family part, how we really influence, how we really support, protect, and then of course at the organization level, then, having standard structures at the organizations to really do it. I think social sustainability, has to be one of the key factors, whether it is through the CSR, various aspects. I'm sure these are some of the ways that probably, organizations and hospitals can also start looking at. I'm sure there is CSR which is taken up, but maybe, along with it, aligning it with maybe, very other aspects of environment would also be very helpful. That would be from me. So let's see how the further discussions go on.
Well said. Thank you, Dr. Usha, for giving your insights. My next question is to Dr. Nitin. So, Dr. Nitin, what are the energy and resource management decarbonization opportunities in healthcare? Can you also tell us what is the approach?
Okay, a very good afternoon, and it's indeed a pleasure to be here, and very heartening to see the KAHO's initiatives on this very important day. So as I come from Environmental Engineering Research Institute, so far until recently for us, hospitals in a healthcare sector means the challenges related to the BMW biomedical waste. But yes, I do agree that it's a growing sector, and every sector has to contribute towards the sustainability. And as far as the GHG footprint or overall environmental footprint is concerned, yes, we all are aware that energy comes as a prime mean. And for the simple reason that despite the fact that India is making great and very impressive progress on the renewables, we are going to have a energy mix, which will be, in fact, dominated by fossil fuel for quite some time. So if you are drawing energy from the grid, you have a high footprint. So that is one reason we need to really reduce the energy footprint from healthcare sector as well. So focusing on that, the first advice from me will be, as others also, I think, propose that a detailed or so-called investment grade energy audit, which hopefully can be made mandatory, because normally there are very good examples wherein whatever you invest in the audit and the subsequent, like the measures, the cost recovery is very, very handsome. So there are 2 points when we talk about the sector-specific energy audit. One important factor in the healthcare sector could be a cooling cum ventilation cum indoor air quality related energy, like footprint. Because here in probably the indoor air quality or disinfection is quite important, wherein we need to do. But there are many innovative options nowadays available for disinfections. Quite a few have already been practiced during the COVID, and ECBC codes could be made mandatory. The second aspect, I would recommend that we can explore the use of sensors and IoT AIML based tools. I have come across a couple of such tools which can identify the energy intensive operations in a building and even in the hospital. But the bigger advantage of these tools, they can even identify the health of different equipments used in any sector, for that matter, even in the hospitals. And they have already tried some experimentation in the hospital. So you have energy management, a very efficient energy management system. In addition, they can identify the health of the equipments and the machines being used in the hospital, so that they can trigger alarms for the maintenance, and that way it is very, very helpful. And that also saves recurring expenses to make it economically viable. So for energy savings, there are some new options which I would recommend for healthcare sector also. As far as the resource managements are concerned, yes, I did read some literature wherein first of all, majority of the literature is from the developed world, and we have a slightly different system. And in India itself, as somebody has pointed out, some expert has pointed out, we have a different category of hospitals and healthcare systems, the government and the private, and they have a different, altogether different footprints. What we can do is we can go for the green supply of, we can greening of the entire supply chain, which is not easy, but yes, I believe the hospital and the KAHO can make a very strong presence in this sector for advising them. There are tools to find out what is the life cycle assessment based overall footprint, and we are growing. So there is another opportunity even in the building sector, because the new building can become very well adopted to the green building concept, while retrofitment is also available. Before I close, I would be a little ambitious that the healthcare sector can also significantly and effectively contribute to, say, Government of India's initiatives like lifestyle for environment. Why I'm saying so? Because the patients, even I listen to my doctor. So when I adopt a few things for my own health, and if that can contribute to reduce my footprint and contribute to a sustainability, that will be really a win-win situation. So I think there are quite a few things which can be done, and we'll be glad to contribute as an institute, as an environmental engineering institute. So I'll stop here and take on a question. Thank you. Thank you for the opportunity.
Thank you, Dr. Nitin. I think you touched upon 3 important factors. One is automation, one is monitoring of energy, and third is on using the doctors, as you say that you believe a doctor very more than anyone else. But that is another factor. And right now I'm in Rajagiri Hospital. We're planning to install the chiller plant organizer. So obviously, such systems, as you said, should become part of the facility, be it new or old building, that actually adds on to the energy savings and finally and certain sustainability. Thank you, sir. Thank you so much. I move on to Mr. Anil Jauhri. Sir, from where you left earlier, I would like to know more about the global scenario on the role of awards or certifications. A few minutes from your side, Mr. Anil, sir.
As I mentioned in my opening remarks also, that there are a number of certifications available which will promote sustainability. It's, as I said, it would be the appetite of hospitals to decide what they want to go for. I mean, ranging from, say, IGBC, the green building certification, to ISO 14001, ISO 50001 certifications, to lots of material certification, in the sense product certification, textiles, even food. After all, that's another element of hospital service. So there are a number, and some initiatives in India, for example, the hospital laundry certification, which has recently launched. So it really depends on what they prioritize and where they go for. Both nationally and internationally, plenty of certifications are available. Thank you.
Thank you, Mr. Anil Jauhri, sir, for explaining on global scenario and about all the certifications. My next question is to Mr. Sachin Joshi. Hi, sir. What are the sustainability frameworks? And tell us about expectation of SEBI, NSA, banking sector, and its impact on healthcare.
Thank you, Arul, for the question.
Just before you start, I'm sorry. Sachin comes with a lot of experience in sustainability. He was very instrumental. He was ex-CEO of sustainability division of CII, and last 20 years of his journey, he's been very instrumental in putting this thought process among the corporates of the country. Please take over, Sachin.
Thank you, Keerthi, for that generous introduction, and thank you, Arul, for the question. I think, what so far everybody on the panel has contributed are very specific issues related to healthcare and these very important small initiatives that hospitals and other healthcare providers can undertake. You asked about SEBI, the stock exchanges, and I'll talk a little bit about the framework that SEBI has put out. What it helps the managements of these hospitals now, whether they are corporate chains or whether they are standalone healthcare units, it does help the managements of these hospitals to connect the dots and put in place a comprehensive sustainability strategy. So that's the importance of that, those frameworks. Now, there are various frameworks and tools from private organizations and the regulators that would help companies from across the sectors, including healthcare, to develop ESG strategy and plans and also disclose information on it wherever it is required. Now, in India, the Ministry of Corporate Affairs and SEBI have developed related ESG frameworks. The MCA's National Guidelines on Responsible Business Conduct is a set of principles spanning E, S, and G aspects of business. Now, companies of all sizes for who MCA is the regulator are expected to follow these guidelines. SEBI's Business Responsibility and Sustainability Report, or BRSR, is a disclosure framework which is based on the MCA guidelines, and the BRSR disclosure is mandated for the top 1,000 companies on the Bombay Stock Exchange as well as the National Stock Exchange. Now, there are also many frameworks from private organizations around the world, which in some countries are also used by regulators and stock exchanges, and even financial organizations to demand ESG performance from companies. Now, all these frameworks are sector agnostic. So even in India, the MCA guidelines and the SEBI's BRSR framework both are sector agnostic. It allows, the benefit of being sector agnostic is that it allows companies to apply them to their own sectors, also the geographies that they operate in. So considering a large country like India, there are often subnational issues, which particularly, standalone healthcare companies could be facing, and also other business contexts that these companies operate in. Earlier on the panel, there was a discussion between Indian companies and companies which are based in the West. So those kind of other geographical and business contexts could also help companies sort of customize these generic frameworks, if I may use the to their situations.
Healthcare sustainability.
Now, now there are specific ESG issues which might vary between the sectors without compromising the overall importance of ESG. Now, these frameworks are extremely useful to management, as I said in the beginning, to chart a sustainable business strategy. It also helps, the companies to become more resilient to future risks, and importantly, also attract low interest finance. You probably are aware that there are now funding lines which are ESG related, and sometimes or in most cases, they are also, low on interest. Now, the financial sector, all types of lenders, including social impact investors, are the largest users of ESG data in screening the investees. And I deliberately mentioned the social impact investors because for the healthcare sector, there is quite an infusion of social impact funds. And they also have started to look at ESG performance of companies. Now, for healthcare, of course, other panelists have elaborated quite a lot on specific environmental and social issues, but there are few which still need emphasis. So, of course, green infrastructure has been mentioned a few times. There's also biomedical waste. There's also cafeteria packaging and office supplies, energy efficiency and energy use. On the social side, I think community health issues, diversity in the organization, which has been quite nicely covered. Also, but including on the board and the top management, upskilling of the workforce. There are a lot of skill and technology changes undergoing in healthcare, and of course, workplace safety. And finally, in governance, sustainability reporting, ESG strategy, community needs, health needs assessments, patient data secrecy and protection, which is again always been an issue, but increasingly an issue because healthcare also increasingly is dependent upon data analytics, ethical marketing and provision of health services, which I would relate also to, the main, perhaps one of the good reasons for, distrust, as was mentioned also earlier in the panel. So these are some of the critical governance issues and other ESG issues for the healthcare sector. I'll stop there. Once again, thank you very much for inviting me to share my views, and I'm happy to take any questions that you might have. Thank you.
Thank you, Mr. Sachin. And that was a great insight into the sustainability frameworks. And we would like to take more questions, but unfortunately, we have a time constraint here. Keerthi, we have Ms. Shobha here today.
No, she couldn't make it. She's in the US. Her travel is shifted to tomorrow. So I think we should conclude with the scene. Mr. Krishnakumar.
Krishnakumar ji, now let me come back to you. Good evening, sir. I know about SEAM. Rajagiri did get the award last year. So what is the journey of SEAM and what is its vision? How SEAM can contribute to the healthcare's sustainability matters?
Good evening and greetings of the Environment Day, and thanks for inviting us. It's quite reassuring that KAHO has taken such steps to vitalize the hospital engineering infrastructure. Okay, and I'm happy to learn about the CAPS also. Hope I am audible. Hello.
Rabina, can
yes,
you?
Sir, you're audible.
Rabina, I request you to mute everyone.
Yes, I'm doing it.
SEAM, ever since its launch way back in 2015, had always supported energy efficiency through advocacy and interventions, and in all the sectors. unfortunately, we couldn't make much headway in the healthcare sector. And now we have got an umbrella plan to address all these segments, including industry, commerce, healthcare, education, transportation, etc. And KAHO's initiative will fit very exactly into that. As earlier speakers have already talked about various aspects of healthcare sustainability, I don't have to go into that. And of course, Dr. Nitin was eloquent in establishing why energy audits, energy efficiency is also important. So that why has been established. SEAM can help you to bring it to the ground. So because all the points which are discussed at a high level structure, now we coming back to the ground level, we can, with our 1,000+ strong professional presence all over country, we can work out a model of flexible and economical energy audit model, which can lead to generating benchmarks based on various categories of hospitals. So that is one of the points which were brought out by the earlier speakers. There are different categories of hospitals which has got different requirements and different consumption pattern as far as energy is concerned. We can develop some sort of a benchmark, then benchmark against the best practices. Then we can even develop some kind of an index from each hospital can strive for betterment of their position. So this, all this can be possible because we can leverage our nationwide spread membership with enough experience. And another thing which is required at the ground level is that training of your engineering personnel in the hospitals, which is as well as an awareness sessions for the other staff, which because with my personal experience in auditing various hospitals, this has been very glaringly unaddressed area, which SEAM can play a great role. And because of our presence all over the country, that transportation costs, all those can be seen, we can develop some kind of a flexible and economical model for carrying out this. So this is how SEAM can help. Of course, it will be achieving its own targets in the healthcare sector as well. With these words, I congratulate KAHO to organize this very interesting panel discussion. Very eminent persons have already contributed. And we look forward to the brass tacks, how KAHO is going to take it forward. And we can help KAHO all over India. That is what I can bring to the table. Thank you.
Thank you very much, Krishnakumar. Thank you so much. And I had a discussion with you earlier again, and today I still promise that we have a long way to go, and SEAM can guide KAHO as a national system to bring in sustainability on a larger scale, not only in terms of training and awareness, but also in terms of auditing, etc. Thank you, sir. Now I hand over the mic to Dr. Vijay Agarwal for the launch of CAPS.
Thank you, Vinod. And it was indeed a fantastic, I would say, deliberations by various people and groups representing diverse groups. And this shows the need of collaboration and the importance of sustainability, especially in healthcare. So at this time, I am extremely happy to launch CAPS, which is the KAHO's action plan for sustainability. And this, I hope, will be extremely important to, I would say, initiate sensitization as well as growing the awareness of the people in healthcare. Also, I would say that the healthcare sector organizations will be able to show their commitment by their assessments, which will be launched through CAPS. And I really wish this particular program a great success. It has a huge implications for healthcare. It has a huge implications for our country and a huge implication for the whole world. So I feel that with the support of all the groups, which were present over here and who have promised support. KAHO is a very inclusive organization, and so will CAPS be. And along with all of you, I think we are going to make an impact in moving towards even at least sensitizing people to the concepts of sustainability, and also moving towards making an impact in controlling things of this nature. Thank you so much.
Thank you, Dr. Vijay. Thank you, sir. Thanks for the launching of this program. Now I request Dr. Karan to give us an introduction about CAMS and its CAPS and its roadmap. Dr. Karan, it's your turn to come up with your plan and the roadmap.
Thank you. Thank you, Mr. Vinod. Is my screen visible to everyone?
Yeah, it is.
Yes. So in the interest of time, I will not go through the entire presentation, but thank you once again to the KAHO leadership for entrusting us with devising this plan, but its success really depends on its implementation and the collaborative approach that Dr. Agarwal alluded to. So we need your help to really make this a success. We've delved upon why we need this right now, and I think this excellent panel has also alluded to it. We know that the issue of climate change and climate action is real, and more than anything else, the climate crisis is a health crisis, and therefore the health sector needs to respond to this. As Dr. Agarwal had said, and many of the panelists have alluded to, the impact of the health sector on the climate crisis itself is quite significant. About 5% of all global emissions come from the health sector, and therefore the need to act on this, whether it is through our own operations or through our supply chain, and that's what led to the creation of CAPS. I just take a quick minute on what we intend to do through this program. We are looking at creating awareness and capacity building. As Mr. Krishnakumar said, that when we see the shop floor, the last person delivering care sometimes is not really aware about sustainability, or at least how he or she can contribute towards it. So we will be having a structured pillar on awareness and capacity building through CAPS. We'll also be providing resources and programs, which includes best practices, case studies, as Dr. Sam Mehta had referred, being a very important part of getting people to know what is happening in the world, what is happening in India, what is happening in other health systems. That will be made available, along with opportunities to learn about how we can actually do GHG inventories and create good roadmaps for us to reduce our own carbon footprints as organizations and departments. We also intend to create standards, another major pillar of CAPS, and give guidelines and checklists for hospitals basis their maturity and size, so that they can actually use these standards to implement programs and projects that can help reduce their carbon footprint. And last but not the least, we'll also conduct assessments, project validations and certifications, and also conduct awards, and which will actually help reward some of the excellent work that is already going on within our institutions, but also basis the work that is going to be undertaken under Project CAPS to become a driver for sustainability within the healthcare system. So we request, appeal, and look forward to your support to join this mission of CAPS to make healthcare greener and also help contribute towards restoring Mother Earth to her vitality. Thank you for your attention.
Thank you, Dr. Karan. Fantastically said, and our roadmap is very clear, with all the support from KAHO, the members at the head table, and all the member organizations, and with the eminent panelists who were there today, who all have vowed to help us in this journey towards sustainability.